Hello again. This week we are looking at the career of nursing as seen by Nurse TV. They captured the spirit of 3 community nurses, and MedWatch is proud to bring you their stories. Next up, meet Jane Ahrenberg. She's a neuro nurse who is often called the field general at Community Regional Medical Center.
It's one of the most challenging and high-tech departments at a hospital, the neurosurgery unit. From complex brain surgeries to spinal cord operations, most of these patients are in extremely critical condition.
My name is Jane Ahrenberg, and I've been a nurse for 2.5 years, and I work at Community Regional Medical Center in Fresno. We're going to take good care of you.
Van a cuidar muy bien.
Okay, you ready?
¿Lista?
For Jane Ahrenberg, it's the beginning of a long day. Her patient has been diagnosed with a brain tumor and requires immediate surgery.
Patty, would you be able to get someone to go upstairs to the 3rd floor and get the stealth MRI for my patient, please?
While her colleagues begin preparing the operating room, Jane checks on her patient.
We're going to ask you to move over to the operating table. It's very narrow.
It's just a straight path.
So we put a safety strap across your thighs.
Put it right up here.
Kind of like a seatbelt in a car, just to remind you not to roll over. Okay, we're in the room at 06.
Today we have a middle-aged woman who she had a seizure, and they brought her in and worked her up, and they found that she has a large tumor on the right side of her head. It's about probably that big around.
Jennifer, here's some 18s. They do need to be sterilized, so it's fine if you go ahead and do that and put them in the set.
Jane is responsible for preparing the OR prior to surgery. She makes sure the surgical instruments and other life-saving equipment is ready to go.
So we put a safety strap across your thighs.
And she always keeps a close eye on her patient.
Patient asleep and ready to go. Okay.
If we didn't have somebody like Jane, all this would come down on me. And I have other things to worry about today, like getting this patient through this safely.
Jane and Dr. Myers
I'll tell you what we can do.
Prepare the Stealth, a state-of-the-art machine that helps pinpoint the exact location of the tumor.
We need the 23 CUSA.
Okay.
The Stealth is similar to a GPS device in a car. Using stickers on the patient's head as guide points and an MRI scan as a map, the Stealth helps Dr. Myers navigate around the patient's brain and the tumor.
So we're turning the patient's bed so that for this procedure, this craniotomy, the doctor will have access to the patient's head. It's always a little bit of a balance between the patient still being close enough to anesthesia, but yet turned away so that the doctor and his assistants can do what they need to do.
Now that the patient has been turned, Jane needs to make sure all of the IVs, tubes, and sensors are still working properly and are secured.
There you go.
Preparation for brain surgery takes hours, but finally, Jane and the crew are almost ready for the main event.
It's amazing how long someone is back there in surgery without actually surgery happening. So I try to tell the family, you know, because a lot of times they'll be out in the waiting room 2 or 3 hours and they'll be thinking, you know, oh, the surgery's taking so long and it hasn't even probably started yet.
There's one more step before the operation can begin. It's called a timeout. Everyone in the OR stops what they are doing so Jane can summarize the case. This ensures that everyone is on the same page before surgery.
The position is supine, x-rays are up, no known drug allergies, blood products, type and screen is ordered.
All right, is everybody ready?
Circulator's ready.
Okay, good.
Timeout is complete.
It's time for surgery, and the life of Jane's patient rests on what happens in the next few hours.
We're going to slot 12.
The surgery was a success, and now that the patient is settled in post-op, Jane is briefed on her recent lab work.
Her labs look good. Crit started out at 38. We got a HemoQ was hemoglobin of 13.
Jane then briefs the recovery team on the surgery.
Her incision is basically from here to here across the top of her head. The skull flap is right here. It is closed with staples, with bacitracin ointment, fluffs, Curlix roll, and then the burn net. It went fabulous. It went much smoother than we even had hoped for. Absolutely no complications whatsoever.
A job well done can be taxing on the medical team.
It is a hot job. You know, you are moving around, you are lifting heavy things, you are, you know, trying to react quickly. It is not a glamorous job, but it is a very, very rewarding and fulfilling job.
Jane, it's great the rest of the country got a chance to see what great work you and the rest of the Neuro team do each and every day.